Okay, welcome everybody to our next webinar in our emotional well-being series. I'm Amy Liebman, President of NTM Info and Research, and I will be your moderator for this evening's webinar. Today's topic is understanding and tackling difficult emotions. We're very pleased to welcome back Dr. Devin Smith. Dr. Smith is a licensed clinical psychologist with more than a decade of experience researching and treating mental health concerns and psychosocial factors unique to chronic illness. She received her bachelor's degree in psychology at Oklahoma State University before completing a clinical psychology PhD program at Washington State University with an emphasis in health psychology. During her training and throughout her career, she has provided health psychology interventions in a variety of settings, including oncology, primary care, internal medicine, cardiology, pulmonology, and infectious disease. She received specialty training in sleep treatment while working at the Georgia Cancer Center for 2 years. In 2018, she was recruited for a faculty position at Augusta University Medical College of Georgia, which involved creating a behavioral sleep medicine clinic. Currently, she is an assistant professor at National Jewish Health in Denver, Colorado, and works within the sleep medicine and NTM fields. Welcome back, Dr. Smith. We're very pleased to have you with us. So for today's session, if you have questions for the speaker, you can drop them into the Q&A. You type your question in and you hit send, and it will enter the queue. And once the presentation is over, I will start asking the questions for Dr. Smith to answer. We will also have the chat open and available. So as questions are asked from the presenter throughout, you can drop your comments into the chat section as well. We'd like to thank INSMED for supporting our programming throughout this past year. Without their support and the support of people like you, we could not continue to bring this wonderful programming to you. So we're very grateful for that. Thank you very much. Don't forget to follow us on social media. You can find us on Instagram, Facebook, Twitter, and LinkedIn. And you can also sign up for our email newsletter so you can follow our news and learn the latest and greatest. You can do that at ntminfo.org. So, Dr. Smith, I am turning it over to you. Welcome. And we look forward to this evening's presentation.
All right, thank you, Amy. I'm going to go ahead and share my screen. All right. So can you see this okay, Amy?
Yes.
Perfect. All right. So tonight, like Amy mentioned, I'm gonna, the chat is open. So I kind of like to make this as dynamic as possible. So if you all have any examples or anything you want to add to the conversation, feel free to type it into the chat and I'll try to get to it and see it as I go through this presentation. If you have a specific question that you want to make sure that I get to, just put it in the Q&A. So we can manage it that way. But tonight, I'm going to talk a bit about emotions. And so, overall in the webinar series, the focus has been on emotions and issues with emotions, how to cope with stress, all those different types of issues. But I want to talk specifically about emotional experiences that are really tricky. So they're causing you a lot of distress or impairment, they're interfering with your life, they're really intense. Or maybe they last a long time or get worse with time. So, in and of itself, emotions should be relatively brief. They should pass. And so if they're not passing, they seem to stick around and be really intense, then, some of these strategies might be helpful. Also, if you've ever felt like your emotions really seem out of control or unmanageable, or it just leads you to kind of quick fuse reactions, some of these strategies may be helpful for you. So just a quick overview of what we'll talk about tonight is, what exactly are emotions? What do I mean by emotions for the format of this presentation? Why do they even matter? And then a little bit about understanding emotions with some various techniques that you can use to get in touch with your emotions, to understand them better. And then how to change responses, because a lot of times that's the tricky thing, is not the emotion itself, but how we respond to the emotions. And then I'll end with reducing overall vulnerability, basically creating more space in your life for positive experiences. So to start out, like why even focus on emotions? So a lot of anxiety, stress, depression issues, they often involve difficulties coping with or tolerating distressing or uncomfortable emotions. So in the mental health or psychology field, there's been a movement to move away from treating individual anxiety, depression type issues and towards treating emotions as a whole, or the way we respond to emotions, learning to cope with emotions. So they call that a unified protocol approach. And so this is something that's pretty timely, that's been developing over the past few years. But someone with anxiety, they might find that they worry so much about the future that it's overwhelming and they can't really think about anything else. It's painful, it's uncomfortable. That emotion of anxiety is really interfering with their life. Or maybe someone with depression, with sadness, feels so paralyzed by this sadness that they just can't motivate themselves to do much of anything. And so those are two examples of how these emotions can interfere with someone's life. So the question often is, sometimes when I was doing more general therapy, the question would be, well, can I just get rid of bad emotions or emotions I don't want? And the answer is no. You really want to try to see emotions as neither good nor bad. They just are. Emotions are what they are. When we start to think of an emotion as, quote, bad, often we try to suppress it, which leads to a whole host of other issues. Suppressing emotions is temporary at best, and it often leads to additional issues. So we're not trying to ignore or push away emotions. We're just learning how to cope with them and how to respond to them. If we were to try to get rid of, some of these negative emotions, would definitely have consequences. One of the first ones is, if you imagine a life with no emotions, there'd be no ups and downs. You can't selectively remove bad, quote unquote, bad emotions. You'd be removing the positive emotions as well. You'd be creating this sort of flat affect where there's no ups or downs. So it'd be very robotic. There would be no, ups or downs throughout your day. You'd just be kind of drifting through. If we were to just get rid of bad emotions, that's also problematic. If there was a way to do this. Emotions give us information, even if they're uncomfortable emotions. So, if you were to take away these, quote, bad emotions, how would you know, if your lives were in danger, if you didn't feel that fear of something? How would you know to stand up for yourselves or someone you loved if you didn't really have a sense of anger when someone was wronged? So the fact is that all of these emotions tell us important things about what's going on in our lives and also how to respond to the environment around us. Helps us navigate the world. So emotions are definitely important and something that, we should value. But sometimes our emotions can get out of whack in terms of how much they're affecting our lives. So I'll give you two examples here. So imagine that you have something coming up with work that's due on a specific date, let's say a presentation. It's pretty natural that as you get closer to this date, you'd start to think more about it, which might make you a little bit more anxious, a little bit more worried, a little bit more nervous. But that might propel you to move forward. It propels you to do some more research, to gather information, practice that presentation, get a good night's sleep before, and you do your presentation and you do okay. You do pretty well. So, that moderate level of anxiety actually served as a positive driver in terms of the behavior that you want. However, imagine though, if your anxiety is super intense. So in, this, let me go back for a second. So in this like red zone here, if your anxiety is so high, it's actually going to be destructive. So a lot of times when our anxiety is high like that, we try to avoid things. And so, you might try to avoid doing this presentation because it just gives you so much anxiety. So you put it off, Well, now, the day before, that anxiety is even higher because you've done nothing to prepare for it. It's more intense. Now you have to stay up all night, prepare for it. You go into it, you kind of freeze up. So, this high level of anxiety, this intense emotion is now disrupting your life, or at least disrupting this, this facet of your life in this example. So, emotions, if they're experienced too intensely for a long period of time, can cause a lot of distress and really get in the way of living the life you want to live, how you want to live it. Also, though, sometimes it's not the intensity of the emotion that's an issue, it's the prompting event of the emotion and the response. So I'll give you another example here. So let's say you were incorrectly charged for something. You didn't purchase it, but your credit card was charged for it. Um, you email customer service, never heard anything back, so you're irritated. You figure out, how you get in touch with customer service. You call them. You escalate the problem, ask to speak to a manager to fix the issue, and eventually issue is fixed or resolved to some extent. So that anger kind of propelled you forward in terms of figuring out a plan, calling someone, asking to speak to the manager. But in this other example, let's say you have a terrible day for whatever reason, and that night someone asks you how your day was, and you completely explode. You just rip their head off. It's just, you kind of react to them in a really negative fashion. So in that example, these emotions and responses to emotions don't always fit the facts of the situation. And that's something that we'll talk a lot more about. So in that case, the emotion here propelled you to respond in a way that you didn't really want to respond. It's probably going to lead to feeling some negative secondary emotions like guilt. And it wasn't even that, the initial prompting event was that question. It was something else entirely, like that bad day that you were responding to. So you can kind of see how wires can get crossed with our emotions and then cause issues. And so really the key here that I'll focus on a lot tonight is learning to regulate emotions. And so what I mean by that is learning to cope with emotions by experiencing them as is. So just as they come up, and not unintentionally increasing suffering. So sometimes we react to our emotions in a way that can actually make them worse. So we might try to avoid or deny the emotion. We might catastrophize about worst possible outcomes, which then just amplifies our emotions. Or sometimes, like in that last example, we react in extreme ways that we're just really not proud of. We're reacting on that emotion versus our logic. And another key to emotion regulation is making sure that you're responding to these emotions in a helpful way. And if not, seeing if you can change how you respond as needed. And then the last one that we'll get to is decreasing vulnerability to emotions that seem out of control, unmanageable, or lead to these unhelpful behaviors. So like I said in the overview, really learning to increase room in our lives for those positive emotions can help balance out some of those emotions that are more difficult. So there's a couple ways that we're going to do this. One is we're going to talk about different strategies for understanding emotions, because you have to understand what's going on within yourself before you can change anything. So increasing that understanding of emotions, that awareness of what emotions are coming up for you, before you can ever start to think about changing responses. And so we'll talk about strategies for that. But I think if you take nothing else away from this talk tonight, understanding emotions, I think, is the biggest key. And then, like I said, decreasing vulnerability will be our last step here. So at its most basic function, emotions have an evolutionary function. So they help us navigate and survive in the world. They're here for a reason. They were developed in us for a specific reason. And a lot of times these different primary emotions are tied to specific functions. They also often trigger us to engage in specific behaviors, or at least the urge to do so. And a lot of times this is automatic and many times adaptive. So with fear, this is essentially an alarm system. It signals danger and the need for attention, you to give your attention to something, you to take action. And so the urge can be to run away, avoid, hide, maybe even respond with fight, that fight or flight response. And so imagine you're hiking, you see a bear on the trail, you have fear, you deal with the threat. That's a very adaptive, maybe hopefully automatic process for someone that encounters a life-threatening situation like that. Sadness, this signals a need to be left alone to deal with whatever is going on. It can also trigger or elicit help from others. So it can look quite passive, which is a signal to other people that you may be suffering or need help. And so a lot of times the behaviors or urges with that come, look like withdrawal, trying to protect yourself, being more passive, being a little bit less active, kind of engaging in behaviors that are protective for yourself, taking time to rest and relax and deal with that sadness. And then with anger, this is signals you to overcome obstacles that can block you, can signal you to defend, protect, increase activity to mobilize efforts. So the urges can involve attacking, asserting, or maybe even preventing future threats. So if you see an issue, it really makes you mad or passionate, you might be propelled to just address this so that it doesn't happen again. So these functions, like I said, can really be protective in a lot of different situations, but sometimes they can also be harmful to us. And I just included 3 basic emotions here. There's a whole host of them, but I just wanted to focus specifically on the types of emotions that I see that cause people the most distress. And we'll talk a bit more about this, but interestingly, some of these emotions can mask other emotions. So some people might be really quick to anger, to feel that anger emotion. But really that anger can be fear, that anger can be anxiety. And so really we'll talk about this, but really looking at those underlying reasons for your emotion can help you figure out what emotion you're actually experiencing to know how to better target it. And so emotions often boil down to very basic primary emotions. And so it's kind of blurry, but you can see over here, we have our anger and our sadness and our fear. And sometimes, like I said, our initial sense of an emotion is really masking another emotion entirely. And so you can see too, when we boil this down to our primary emotions, it also branches out into secondary and tertiary emotions. And so this is all way more detailed than you need to know. But just being familiar with the idea that these emotions, the emotions that you experience often can boil down to very basic primary feelings that are ingrained in us. For instance, down here, like anxiety and nervousness, really that is fear. So when we feel anxious, worried, concerned, a lot of times that's fear. When we feel upset because we feel like we've been rejected or someone doesn't care about us, we feel neglected, really that's sadness, boils down to sadness. And you can see anger has a bunch of different offshoots here, but sometimes, we might just be frustrated with the situation. Really, that's anger. If we're disgusted or really feeling like revulsion for something, that's anger. So I'll send these slides, but these emotions can often boil down to these basic primary emotions. And drilling down a bit, asking yourself some questions when you experience an uncomfortable emotion can be helpful. So like with anger, let's say, asking yourself why you feel angry in a certain situation. So let's say, you cook dinner and you're expecting your husband or wife to be home for dinner and they didn't come home. And so you're really feeling pissed, you're angry. If you drill down a bit and you ask yourself like, okay, well, why am I angry? Because he or she was late to dinner. Ask yourself, what does that mean to me? Why does that matter? Well, he doesn't care. He doesn't care enough to show. All right. So what does that mean for you if someone doesn't care about you? Well, I'm not important, or I'm being taken advantage of, or, I'm being neglected. So really it boils down to sadness. That anger that you initially was the most prevalent expression really boils down to sadness if you drill down and ask yourself some questions. And when I say ask yourself, this is also something a therapist could help with if you do ever go to therapy. But you can try to drill down and figure it out for yourself. But knowing that true emotion, sometimes that's really empowering to know, okay, I'm not actually angry at him. I'm sad. I'm hurt. That really can change how you respond to a situation. So, once you realize you're sad, your go-to response might not be to scream at someone. It might be to express how you feel, to show someone that you're vulnerable and hurt. Um, so, like I said, drilling down can really be helpful. Before I move on to the next little piece here, I want to show you an example of something. So basically, how we view the world, our emotions are heavily influenced by outside factors. So temporary moods can influence our perceptions, interpretations of events, and even change our emotional responses. So the same information can take on a very different color depending on our current emotional state. So I'll show you this with two examples. Some of you are going to recognize this movie, but try to just pay attention to the surroundings as I show you this. And so, when we go into a situation with this underlying emotion, how we view things is going to change, and that's going to change our resulting emotions. And did I get this back okay, Amy or Helga? Can you see the slides again?
Yes.
Okay, thank you. So actually, if you ever want to YouTube it, because it really was a cool example. You can YouTube like opening scene of The Shining with happy music, or just the opening scene of The Shining, and you get totally different feels for what's a pretty neutral video. So, just this drive in and of itself doesn't really pull a lot of emotions, but how you pair it with music can definitely change that. And so this kind of leads into something that I think is really helpful. When you experience an emotion that is really overwhelming, distressing, the intensity of it is pretty high, ask yourself if the facts of the situation fit with that emotion or the intensity of that emotion. Many times it does. So I'm not saying that your emotions are completely invalid. We shouldn't be feeling any certain way, because that's not the case at all. Really, the case is you want to make sure that what you are experiencing matches the actual situation. So kind of like with that video example, your emotions are going to match whatever you feed into, whatever you read into that. So how you read into these prompting events is going to flavor your emotions. And so there's some steps here for how to check the facts of an emotion. One of the first things is to figure out what prompted that emotion. So what caused this emotion? And sometimes this can be actually a trickier question than it seems, particularly if there wasn't a clear external event that happened that caused this emotion. Then you have to look internally, like what about this situation is making me sad, making me angry, making me anxious. Describe the facts, though, that you're observing. And so this could be a past event. It doesn't have to be immediate or in the current situation. A lot of times it is current. But what actually can you see? What can you hear? What are the facts of a situation that someone could agree to no matter what? So with that example of, cooking someone dinner and them not showing up or showing up on time, the fact of the prompting event was not, this person doesn't care about me. That's an interpretation. That's not the exact prompting event in a factual sense. The prompting event was, I made dinner and he was late. Anyone can agree to that. Those are the facts of a situation. Those can be observed. And so, like I said, it can be a secondary reaction to a previous emotion. So like feeling angry at yourself for being afraid, that can be a prompting event for an emotion. And then ask yourself, what am I telling myself about this situation? What are my interpretations, my thoughts, my assumptions about this? And could there be other interpretations? Could there be other ways of viewing this? You want to try to see this as flexibly as you can. A lot of times we react to our thoughts and interpretations of events rather than the facts of the events themselves. So in that, again, dinner example, that sadness is probably a reaction to the interpretation of someone doesn't care about me. I'm not valued in this relationship. So that really can often flavor the whole emotional experience, is what you're telling yourself about this situation. Then asking yourself if you're assuming a threat. Most of the time we are. If we're experiencing a painful emotion of any sort, it's usually almost always related to some type of threat, either real or perceived. So it's really important to figure out what that internal threat is that we're reacting to. So back with the same example with the dinner, that sadness, it's related to this threat of like, maybe this person is going to leave me. I'm not cared about. This, I could be expendable. Or the threat is a bad relationship, there's some sort of threat here that's being perceived, an outcome that's being anticipated. And so thinking about what are the chances this will occur? If someone missed dinner, does that mean my relationship is ending? Maybe so, but maybe not. What are the likelihood? What are the other possible outcomes? And then asking yourself if you're catastrophizing. Sometimes things are every bit as bad as we think they are. So 100% the answer could be no, I'm not catastrophizing. This is the fact of the situation. Other times we could be making a bad situation worse by catastrophizing the facts or focusing on these worst possible outcomes. So an example would be like losing your job. That can feel terrifying. And so why exactly is that terrifying? Well, maybe you're thinking of, losing your house, not being able to afford your mortgage, whatever those consequences are, you're kind of jumping to the worst case scenario, which of course those are possibilities, but looking at a possibility as an absolute can often lead to more uncomfortable emotions. And then the last one here is, does my emotion or its intensity fit the facts? So does this emotion match the facts of the prompting event? So this event up here, if it does, okay. Does the intensity of my emotion match this? So, someone who loses their job, reacting as if they're entering a life of poverty, despite having a good savings, built up for emergency situations. Does that intensity of this, extreme anxiety, fear, sadness, does that fit with the actual facts of the situation? And so this, again, isn't to invalidate or, diminish emotional experiences. The goal here is really to look at the facts and make sure that they match so that you're not experiencing emotions that are so extreme or uncomfortable that could interfere with your life. So another strategy here, it's called a 3-component exercise. It's kind of looking at the same type of work in a different light. So what I mean by that is looking at emotions in a little bit more detail, sort of like with checking the facts. So in this type of thinking, the idea is that emotional experiences involve 3 different components. So 1 is what we think, 2 is what we do, and 3 is how we physically feel. And so a lot of times thoughts are often what triggers these uncomfortable emotional states. So I kind of hinted at this in the last exercise, but let's say someone's, experiencing a lot of sadness, having thoughts that a situation is completely hopeless. So they might tell themselves, what's the point? Why even try? Nothing's going to help anyway. And so that's, what you're telling yourself in that situation. Similarly, to what I've already talked about, but emotions can trigger actions or urges that may or may not be justified by the facts. But, with that sadness, that I just talked about. Let's say the behavior is to stay in bed all day, give up. Why even try? And so that could be the urge or actually what you're doing in that situation. And then sometimes, we can respond in a certain way that impacts how we feel inside our bodies. So, physiologically responding to emotions. So a lot of times sadness can be accompanied by a heaviness in the limbs. Anxiety can be like upset stomach or, these pins and needles in your hands or feet. And so there's some sort of physical sensation oftentimes that accompanies an emotion. In my work, I've found that this one tends to be the part that people are less cued into with emotions, but it does vary person to person. So, you might be really aware of what you're doing, but you're less aware of what you're thinking or what you're feeling inside yourself. And so starting with whatever is most readily available to you. So like if okay, I'm doing a lot of yelling at my significant other. Well, okay, that's the behavior. That's where you can start. So in that most recent example where you yelled at your significant other, what were you telling yourself in that moment? What was going on inside your head? And then usually this is easier if you're doing it either right as the event is happening or right after, but like, what can you feel in your body? So with anger, a lot of times people feel like a hot face or, this kind of discomfort in their chest. So getting in tune with what you're experiencing physiologically or physically as these emotions are happening can actually be a really good way to cue in when an intense emotion is coming. If you kind of notice the sensations in your body, you can predict when that emotion is going to hit. So cluing into these different factors that are involved with emotions can be helpful. Another strategy here is they call it the arc of an emotion. So emotions don't just come out of nowhere, even though it sometimes may seem like that. Every emotional experience is triggered by some event or situation which caused us to react and respond in a certain way. So monitoring these experiences can help us gain a better understanding of emotions, which can, in the long run, help make emotions more manageable. So we can't really manage something we don't have a lot of insight about. And so doing these different exercises can really help you gain more awareness so that you can make changes. Whenever you do any sort of monitoring like this, doing this as closely to real time as possible is beneficial because we forget details. If I were to write down an example of an emotional experience I had yesterday, I'm going to forget a lot of pieces of this. Or I'm going to start interpreting it with that space of time since that event occurred. I'm going to start thinking about, well, what happened because of that? Well, now it's flavoring how I felt about the event. So really you want to try to do it as closely as possible to when it actually happened so that you can understand when, where, and why these are occurring in the first place. So, you can ask yourself in a situation, like, what was the trigger? Like what triggered this response or this emotion? Were there other things that happened earlier in the day or the week that influenced how you felt? So let's say that the event or trigger was that you missed a doctor's appointment. So, you'd write that in there as the situation for this antecedent. That's a fancy way of saying the situation. So missing a doctor's appointment, maybe something that happened, before you even got in the car to go to the doctor's appointment was you slept in. You overdid it yesterday. You're exhausted. You overslept and now you're late trying to get to the doctor. And so the next part here then is what is your response? And this can be broken down into these 3 categories. So first, what are you telling yourself in that moment? As you're driving to the doctor's office, it's already past your appointment time. What are you telling yourself? Maybe something like they're going to think I'm completely incompetent. I just can't get my act together. This is so frustrating. Whatever those thoughts are, kind of cueing in internally and see what you're telling yourself in that situation. And then what are your feelings or physical sensations? So when you're in that car having these thoughts, driving to that appointment, maybe you notice that you're anxious, you're frustrated with yourself, your stomach feels upset. So those are the kind of feelings that you'd note. And then what did you do? In that moment, what did you do about it? So maybe this person gave up, drove back home, kind of screw it, I'm going to miss the appointment anyway, like so frustrated. I've definitely been in that situation where I'm so frustrated with something, I just give up. And it could be with myself. So, giving up, going home, that would be a behavior that someone might do if they're experiencing frustration, anxiety. And then every behavior or every way we respond to something has consequences. And so consequences, I think a lot of times are automatically linked to something bad happening, but it doesn't have to be bad. It could be good or bad, but it's basically just what happened next. Because of this, what happened? That's the consequence. So what were the short-term and the long-term consequences of how you responded to this situation? So your thoughts, your feelings, your behaviors, what were the consequences of those? So maybe in that example, person was mad at themselves for missing that appointment. That's the short term. They were just upset the rest of the day. They were angry at themselves. And then long-term consequence, maybe it takes them weeks to reschedule because they're embarrassed that they have to do it in the first place. So they just avoid it. And so you can kind of then start to see how these different facets are interlinked to a full emotional experience. And so doing these types of exercises helps give you more insight into what happens when you experience an emotion, and what are the consequences, because you can start to interfere at any little chain in this link. So that's kind of the ultimate goal with building this awareness, is so that you can start to respond differently. Another exercise that you could try, they call it practicing non-judgmental emotion-based awareness. And so if you've ever seen any of my other webinars on more of the mindfulness type strategies, so I think I talked about it in the stress management webinar, but really building this awareness is just being an outside observer almost of what's going on inside you. So non-judgmental, because you're not going to make any distinctions based on what you're experiencing. You're just observing. So you're paying attention to what's going on inside you. You're not evaluating. You're sticking with the facts. You're not making interpretations. And you're accepting whatever it is that's coming up. You're not trying to push it away. So watching your thoughts happen. I like to think of this like a bird's eye view, like taking a step back and looking in from above, and seeing what's going on just with your thoughts that are passing. This is harder than it sounds. It's hard to just watch your thoughts without jumping in and influencing those thoughts. And so if you practice this, don't get frustrated. You're probably going to have to bring your attention back to your thoughts 1,000 times. And that's okay. Just letting those thoughts come and go, but not really latching on to any particular thought. Another one, is observing your feelings in any given moment. So kind of watching it ebb and flow of intensity. An emotion is an emotion, not really tying any weight to it, just noticing the actual feelings that are coming up. And then any various sensations in your body. So you can do this by kind of closing your eyes, scanning your body from head to toe, and trying to notice what's going on in different areas of your body. And so this is a good way to build this emotional awareness, is to be more like an investigator, a curious observer. So not making judgments, but just watching. All right, so switching gears a little bit from understanding emotions to what to actually do about these emotions if they occur and they're distressing, they're intense, they're uncomfortable, and you're not responding in a way that you want. So if the behavior is a way to control negative emotions, it's likely not helpful. So when it says here, examining behaviors driven by emotion, asking yourself, what was the purpose of that behavior? Like, what was I trying to do in that moment? When I poured myself that glass of wine, why did I do that? Am I anxious? So I'm gonna have a drink. I'm gonna have a glass of wine. If I'm, telling my husband that, he didn't do something that I wanted him to do, what's the purpose of that? What's my emotion and what's my purpose in telling him that? Am I trying to influence his behavior? Am I trying to avoid some other negative emotion I'm experiencing? But a lot of times our behaviors that are less helpful are usually trying to control these negative emotions. I'm going to yell at my husband or air this grievance to get rid of this discomfort that I'm experiencing. It's not always a bad thing. Sometimes it is reasonable and adaptive, but sometimes it's not. So, was this reasonable, adaptive, given the facts of this situation? So I kind of already walked you through how to check the facts. So was this something that makes sense in a way that wasn't based on interpretations and assumptions? How did you feel when you engaged in the behavior? Afterwards, I guess. How did you feel after you engaged in that behavior? And would you have liked to have acted differently? So, if the answer to some of these questions makes it seem like maybe my emotions aren't aligning with my behaviors, or maybe my behaviors are not ideal, then you might want to try some of these other strategies. One is called approach versus avoid. So this is, when you find yourself really avoiding certain emotions, really common with anxiety. So if you're finding yourself kind of avoiding certain situations or issues, try approaching it. So engaging in activities and situations that bring up these emotions that you're avoiding, but getting used to that feeling, using coping skills to show yourself that you can handle it. I've talked about different like stress relief and relaxation strategies in other webinars, but there's things like deep breathing, kind of reframing your thoughts, how you think about things, but finding ways to cope with that emotion versus totally avoiding it or avoiding a situation that causes that emotion. And so, of course, this is within reason. I'm not telling you to go into dangerous situations and get used to the fear of life-threatening situations, but more in the sense of situations that aren't actually tied to a real threat. Avoiding, maybe you hate being social. You get real anxious in social situations, so you avoid them. But that's not really, in line with how you want to live your life. You don't feel good when you don't go to social engagements. You wish you had acted differently. The purpose of it was to avoid that anxiousness that comes with being in a social event. So in that situation, maybe try approaching it. Force yourself to go to something social. Force yourself to be there the whole time. Don't give yourself an out. Sit in that discomfort and show yourself that you can cope. The more you avoid something, the stronger it reinforces it. So every time you avoid something that makes you uncomfortable, you're more likely to avoid it in the future. So let's say you're avoiding going to the doctor because you're really scared at what those results are going to be for whatever test you did. So you cancel or reschedule. Well, the next time it comes, your anxiety is probably going to be even higher. So you'll cancel or avoid again. Eventually, maybe you can't escape it, but it's going to reinforce that behavior of avoiding, of kind of exiting the situation to manage your anxiety. And then another strategy here, they call it opposite action, but this is essentially doing something that's completely different of how you would normally respond to your emotion. Changing how you behave can start to change your emotions. And so I really want to highlight, though, that this is different from ignoring emotions. This isn't, pretending you're happy all the time when you're feeling sad. This is when an emotion is really intense, really uncomfortable. The duration doesn't fit the facts, or you're, again, responding in a way that isn't helpful. Sprinkling in some of this opposite action can help. So still giving yourself space to process emotions, but choosing responses and investigating how you want to respond. So especially, like I said before, emotions should pass, but if it's sticking around and interfering with your life, consider doing something different. Um, so here it has some different steps, but identifying an emotion that you'd like to change, what your urge is for that emotion. So let's say you're depressed and your emotion is sadness, you're feeling really sad, and your urge is to avoid, to shut yourself in, to remove yourself from the world, in terms of just staying in bed, not doing anything. Well, in that situation, if that's an emotion that you want to start to change, try doing something completely different, like engaging in the opposite of that urge, getting up, going out, forcing yourself to do some activities. That would be opposite action that could work towards changing this unwanted sadness that you have lingering. And so here are some examples of different, emotions, the action urges, and some opposite actions. So, if you're feeling really angry, maybe your urge is to attack the person that's making you really angry or the situation. So in that case, maybe you try talking to the person in a calm, soft voice. That would be the opposite of screaming at someone. And so these are little examples of how you can act in opposite ways of your emotions. And these don't have to be extreme. These can be subtle too. So, if you're feeling self-conscious, you're slouching, sitting up, that's opposite action. If you're feeling really sad and you've given yourself space to experience that sadness and it's still not going away, trying to smile a bit. I know that sounds silly, but there's been some research that shows if you force yourself to smile, sometimes your emotions start to change. You're feeling really anxious, you're at a medical procedure, you're scared, the pain is just really intense, you're tensing up, trying to relax your muscles. It's hard, but it actually does help with pain. So opposite actions in terms of changing those emotions. And then I'm almost out of time, so I'll just go through this really quickly, but reducing vulnerability overall, creating a life that's worth living. So increasing your vulnerability basically to positive emotions. There's a couple of different ways that you can do this. The particular type of therapy that I'm borrowing this from loves acronyms. So this is called ABC. And so that stands for accumulating positive emotions. So just increasing events that could lead to a positive emotion. This doesn't mean that it necessarily will, but it has the possibility, and trying to do something at least once a day that could lead to some of those positive emotions. And then when you are experiencing positive emotions or even positive events, focusing your attention on them, staying in the present moment, don't multitask, participate fully, and engage fully. And then making changes in your life so these positive events might happen more often. What do you need to do? What's a barrier to having these positive experiences? And is there any way you can change that? Another way to reduce vulnerability is through building mastery. So mastery helps us feel in control, competent, confident. So trying to do at least one thing a day to build this sense of accomplishment. You want it to be difficult, but possible. So, you're not going to, I'm not going to say I'm going to, trying to think of something I need to do. I need to weed. Like my entire outside is awful. I'm not going to tell myself that I'm going to fix my entire backyard situation in one day. That's not possible. And it's just going to lead to me feeling frustrated when I don't do it. But maybe I can weed one specific area. It's something that I don't enjoy. It's something that's a little bit difficult for me because it hurts my hands, and I could talk on and on about all that, but it's possible and it's difficult. And so it doesn't have to be something necessarily that you haven't done before. It could be, if you paint, doing some sort of art project. If you're into music, engaging in some sort of musical endeavor. You basically want to look for a challenge and then increase that difficulty with time so that you can feel this sense of accomplishment. And then C is cope ahead. So thinking about situations where emotions are likely to be difficult if you know you're going to a doctor's appointment and you know that causes you a lot of anxiety, thinking ahead, being prepared, not necessarily being prepared by telling yourself, the worst is going to happen, but being prepared in the sense of, if I get really uncomfortable, how can I decrease my discomfort? How can I stay grounded to the actual facts of the situation versus, where I know my mind is going to throw me. Decide what skills you can use and be ready to use them. So, if it helps you to bring, have a game downloaded on your phone to play while you're waiting, or, bring a friend with you, or, just some way that you're coping ahead in the event that these uncomfortable emotions are likely to come up. And then along with the ABCs, this is the last one. Like I said, this treatment loves acronyms. So this one is PLEASE, which I think is a real stretch if you look at how this is laid out. But it talks about, reducing certain vulnerability areas to increase, again, positive emotions or positive experiences. So taking care of your body, being preventative with physical illness, doing your breathing treatments, taking your medications, really trying to get ahead of that as much as you can. Balanced eating, I like to highlight, that means eating regularly too. Not skipping meals, not waiting to eat, eating regularly. Avoiding mood altering substances. This doesn't mean that you can't have alcohol ever. Well, maybe if you're on certain medications, but if your doctor says you can have alcohol, this doesn't mean that you can never have alcohol. But as you may have noticed before, having alcohol often increases emotions. So just using in moderation when you can. Prioritizing sleep. So I have a whole talk on sleep, so I won't get into the details with that. And I think I'm going to be doing another webinar on sleep, but basically just trying to stay consistent, trying to get the amount that helps you feel good, helps you feel rested. And then exercise. So just doing some sort of activity. Doesn't have to be major exercise, but just moving your body and trying to do some or all of these every day. These are things that you can do to help take care of yourself that can prevent some of these persistent, difficult emotions. All right, and that is all I have. So I went almost the whole time, but if there's any questions.
If anybody has any questions, you can drop them into the Q&A. I have a question for you.
Yeah.
Let's start with this. So going back to the PLEASE acronym, where you talk about eating, balanced eating. And you mentioned that, one of the things about balanced eating is eating regularly. What do you recommend for people who, for example, sometimes people don't have an appetite, like if they're on a medication that alters their appetite? What do you think, what do you recommend for them to do to try and make sure that they're at least getting some of that balance?
Yeah, I mean, I'm not a dietitian or a nutritionist, but something that I like,
feel that they like getting some of that balance, that they don't feel like completely out of whack.
Yeah, I think protein, like bars or shakes, can be really helpful in those situations, something where you're getting some protein, but it doesn't feel like you're having to eat a big meal. Because yeah, appetite definitely can shift, particularly given your medications. But just try not to just give up on eating entirely because you don't feel that hunger, because that's just going to decrease your energy more. It's going to make you more susceptible to some of these negative emotions. So trying to eat when you can, but also trying to build in, I think, hopefully Michelle would agree with me, but building in some protein as you can, I think, can be helpful. Also staying hydrated. I know that sounds really basic, but sometimes when I'm feeling like I'm just off emotionally, I'll think, okay, when's the last time I had a glass of water? I haven't had any water all day. So just like little things of like, okay, when's the last time I ate? When's the last time I had a drink of water? Those are just small things you can do to help with emotions.
Okay, we have a question that was dropped into the chat. How do you keep anxiety under control when you have to go to the ER? I have difficulty with my veins, so I immediately think of IVs way before I might get it.
So I think one of those, two ways. So one is, teach yourself some good relaxation skills. So this can be breathing, this can be mindfulness. There's great apps out there that have a lot of this on there. The Calm app is one of them. Don't pay for it. Just try the free content and see if you like it. Using guided audio resources to learn these skills so that you can then use them even when you don't have the opportunity to listen to it can be helpful. So that's step one, I think, is learning to decrease your basically your activation response by lowering that sympathetic nervous system. So through breathing or whatever it works for you. Number two is thoughts. So I think I highlighted this somewhat in this talk, but I think I did in another talk as well. But what we tell ourselves has a lot of power. And when we take those thoughts as fact or 100% truth, it starts to change how we react and also how we feel. So if you're going to the ER and you're terrified that you're going to have to get an IV, recognizing that I'm having a thought that I might have to get an IV versus I'm getting an IV. Those are two very different situations. And so recognizing that, yeah, you're worried about it, but that's just what it is at this point, is worry. It's not fact. So I think, and again, I'll tie in the last one, coping ahead, having a plan in place of, you're not going to know exactly when you have to go to the ER, but maybe even thinking through it, tonight, tomorrow, something, what can you do? What resources can you bring with you? If that situation comes, how can you calm yourself down? And how can you change what you tell yourself in that situation? So I don't know if that answers your question, but those would be my recommendations.
Thank you. Okay.
Yeah.
Here we go. We have an coming up. Okay. Oh, the person who asked the question said thank you. Next question that popped up: what is the primary emotion for the feeling of shame? Do you have any suggestions to cope with feeling shame?
So shame, sadness. So that's a tertiary emotion for sadness. Shame can be really powerful. I think digging a little bit deeper of why you're feeling that shame and if that's fact or if that's an interpretation. So a lot of times we feel ashamed of certain things when, I'm trying to think of an example, like feeling shame about not being able to help out around the house. Well, what expectations are you setting on yourself that, is triggering this shame? And so looking a little bit more deeply at why you're experiencing that shame can often pop up different assumptions and interpretations that you can ask yourself, is this 100% true? And if not, why? So I think for this one, challenging your thoughts around it can be pretty helpful with shame. I think I did, not to keep queuing back into my own talks, but just because I know I've have some content out there about kind of shifting how you think about things. Because yeah, I think shame is heavily linked to what we're telling ourselves about a situation, about ourselves.
Okay, thank you. Last call for questions. Oh, here we go. She says thank you.
You're welcome.
All right, last call for questions. This was, I think, very helpful. I think especially being able to understand and recognize the emotions and sort of what primary emotion they belong to. I think is very helpful.
Just take a curious mind. That's my biggest suggestion out of all this, is just be curious and look at why you're reacting a certain way and what's driving it.
Okay, well, thank you very much.
You're welcome.
Okay, I am going to share my screen to make one more quick announcement. We have another webinar coming up, which I think a lot of you have heard about already, and you're quite excited about. We have a webinar coming up in honor of World Bronchiectasis Day. We have an update on bronchiectasis treatment, including new investigational therapies, with Dr. Ann O'Donnell and Mary Kitlowski, president of Running on Air. A lot of you know Mary. You've probably seen pictures of her running marathons with her portable oxygen concentrator on. She's done a lot of that over the years, and she's done some wonderful work raising awareness for bronchiectasis. So that's Monday, June 27th at 2 o'clock Eastern. Registration is open for that webinar now. So I'd like to thank everybody for joining us. We really appreciate you coming out this evening. And Devin, thank you for another wonderful webinar.
Of course. Thank you all.
Thanks, everybody.
Bye.
Have a great week. Bye-bye.